This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning and welcome to the show. We promise you no hurricane here, just good information, all right? And good information to keep you and your family healthy. That's the mission statement and the goal of this show. Each and every Sunday, 8 till 9, we call it Health Watch here on Talk Radio 1210 WPHT. As always, Dr. Molly Fantasia is here, the PhD doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. We'll go over everything about Innovative Medical, the who, what, when, where, why, and how. Go over some recent cases and whatever your questions happen to be. Or if you want to run by you have a medical challenge and you want to get some help from Dr. Molly, that's when you call into the show, 855-839-1210. 855-839-1210 is our number here in the studio. And again, it's Health Watch every Sunday, 8 till 9, here on Talk Radio 1210 WPHT. Dr. Molly, we talk about no hurricanes, but really it's good information and good things that people should know about what you do, which leads to the question of what do you do?
Well, we are a primary care facility, and we have a cooperating agreement with physicians who actually can do anything that any other primary care facility can do. So if you need a blood pressure med, you need an antibiotic, you can come in and get that done. However, it is the philosophy of all our providers, as well as my philosophy from the beginning of founding this, that we want to use as much of God's ingredients or natural substances as we can to effectuate a change, improve a patient's quality of life, and in doing so, minimize the risks or the side effects from the medications.
And just about every medication that you take
has a side effect.
And they give you a list of potential side effects.
Right.
Which is like a laundry list.
Sure. And the thing is, the biggest thing we see in our facility is that people come in, and generally they're on more than one medication.
Right.
And if we can help them reduce the dosing of some of those meds and or get them off some of those and reduce the quantity of the meds, that's a win for us because people start to feel better almost immediately. It's unbelievable. But the key is you've got to do it right. It's got to be medically, appropriate for that patient. And that's really why we all get together and actually utilize hydration as the vehicle to deliver the natural substances that tend to augment the pharmaceuticals.
And, a lot of people tend to do this, and you've always said don't do it. They'll take a medication and there's some side effects and they'll just stop taking it.
Yeah, it's bad. That's very bad. It's almost better that you didn't start the medication in many cases. Now in others, you're running the risk. So the question is, you always want to make sure you speak to your medical provider before you start reducing your meds. And in our facility, the beauty of how we utilize the hydration is we see people in a very more often, let's say, than people who would go to their family doctor. And so we're able to really get involved with you. And you see I walk that clinic floor at least 3 or 4 times a day. And in that, people stop me, and we don't violate HIPAA because the patient is asking the question right out there with other people. And interestingly enough, people get a lot of information from other patients, which is interesting to me all the time.
Yeah, I had an interesting discussion the other day with 2 of your patients. And we start talking about restaurants at the shore.
Oh, well, that's okay, too. Well, one thing about my group, boy, they really enjoy the quality of life issues.
Right, and it really was a great discussion.
That's cool.
And I gave them several good restaurants to go to.
That's cool.
Yeah.
That's very cool.
But the point is that you utilize actually, that's the cornerstone of your practice is the hydration.
Right.
Why is that?
Because we're able to deliver appropriate amounts and in appropriately synergistic way so that we can deliver what we need to effectuate the change. The problem is, and we speak about this every week, you can go to the health food store, sure. And, I have a patient right now who actually is a salesperson for nutraceuticals. My God, she gives out a ton of information, everybody. And all the time I say to her, hey, could you help me out and stop giving out all this information? Because you're telling them what to get, but you can't possibly tell them how much to ingest. And she goes, yeah, that's right.
And she doesn't know their condition.
Exactly. So I'm very astute at this, and I tell everybody, listen, it's great to share information, but just remember, you've got to share information that becomes appropriate to your condition and what's going on for you. Because guess what? Yeah, she reps a wonderful line. I'm not saying she doesn't. I'm saying, though, use everything judiciously, because we do.
It's interesting because you've often talked about Dr. Internet, and this is kind of the same thing, right?
Well, she's a little more knowledgeable than
Right.
Dr. Internet. But the point is, as I tell her and everyone else, bottom line is you want to make sure you get some professional advice, because you go into the health food store. And by the way, I'm mentioning this because it really is a symptom of the health food store. You go in, somebody who may or may not have the ability to help you does, or sends you to an aisle to pick out whatever works for your cardiac condition. Well, that's not good enough.
No.
That's it.
Because they don't know your specific condition.
Exactly.
And, sometimes they're people who are nice people.
Oh, yeah, I have another gentleman who owns a health food store, very knowledgeable guy, but you don't hear him on the floor saying, well, you should take this or you should take that, because guess what? He's smart enough to know, listen, come into my store, let me talk to Dr. Molly and find out, really, do I have your permission to talk to Dr. Molly and the gang and find out what's really going on? Well, that's an intelligent way to do it.
People always ask you, and we talk about this just about every week on the show, does the hydration therapies work? What can you tell us about that?
You bet. And the real key to that is to look at the quantitative data. In other words, you come in with a certain cholesterol, you're leaving with a much better one. You're coming in with certain liver enzymes, and if you're in the appropriate treatment protocol, you're going to leave with them back to normal. These are the things. Plus, but more importantly even than that is, how do you feel? When you come in and you're dragging, what will happen is you're going to feel a whole lot better if you follow the program. And I will tell you, people generally do, John.
It's people say to me, "Oh, you're getting that treatment again this week." I said, "Yeah, Tuesday and Thursday." Well, what do they do?
Well, all you can do is say you work 7 days a week. Am I right? You work 7 days a week.
Yes.
I mean, you're a very popular talk show host on another station. You get a lot of calls. You're always on the internet. You work. So I don't know. I don't want to give away your age, but I would say we're contemporaries.
Yeah,
right?
we are. We definitely are contemporaries.
Right. And so guess what? We work. We're living proof that this does work.
Interesting, talking about our age, we grew up with Sally Starr.
That's
and
right.
Before she passed, she was a patient of yours.
Absolutely.
Thinking about people we used to watch when we were kids.
Absolutely. And I will tell you, she was a hard-living woman, and I loved her, and she was a lot of fun. And we've treated quite a number of celebrities in our heyday.
So what can people expect? And I know you get a lot of consultations. I mean, this week I met a couple of people who heard us on the radio.
Sure.
And they came in for the consult. But I guess they always kind of don't really know what to expect. What can you expect if you begin the hydration therapies?
Well, first of all, what we are going to do is we're going to draw some blood. We're going to make sure that the particular nutrients and one of your old friends, vitamin C, you're able to utilize the appropriate doses of vitamin C, which, by the way, is almost in everything. That's no secret. What is the secret is the extracts, which ones I use for particular challenges. But we'll probably draw bloods. We want to look at comprehensive metabolics. We want to look at CBCs, just to name a few. And then what will happen is you're going to fill out paperwork just like you would at any doctor's office. You're going to sit down, do this for us, and we're going to go through an integrative checklist as well. What nutraceuticals are you on? What's happening? And then we're going to actually outline what's going to go in your bag.
And that's really where you determine
exactly
the protocol that you're going to use.
Exactly.
And speaking of, because people always ask you, well, Dr. Molly, I have this and that. And every week we get calls and people have different medical challenges. But you have over 600 protocols.
I do. But it's interesting. There are some things that are in all of them.
Right.
Okay? And we know vitamin C is most likely in most. Not always, but most likely in most.
And you've often talked about, so people can understand, the synergy of the mixture of what you put in.
Exactly. You know, it's like making a cake. This is my new thing, or mixing your cocktail. It's how you put the particular items together and whether you stir or shake. That's the bottom line.
Okay, we're coming up on our first break of the morning. It is Health Watch. That's the show. And we are here every Sunday, 8 till 9, Talk Radio 1210. WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210 is the number here in the studio. You got a question for Dr. Molly? We always tell you right at this point of the show, we have plenty of time left, so which means you have plenty of time to call. And a lot of times people say, should I call? Should I not call? I don't know if I should call. And then by the time they call, it's like 2 minutes left of the show. So call now, 855-839-1210 with Dr. Molly Fantasia. I'm your host, John DeMasi. We return. More of today's edition of Health Watch after these words. Back here on Health Watch, operators standing by right now at Innovative Medical Associates. And if you would like to contact them, you want to make an appointment to sit down with Dr. Molly. This sounds like something you at least want to explore. That's what you do. You call them right now, 856-489-0505. Notice I said that slowly so you could write it down. 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. And like I said, you call and you just schedule an appointment with Dr. Molly. The initial consultation is complimentary. You can check out the web, too, innovativemedicalassociates.com. Someone asked me the other day, can I hear some old radio shows that you have done, or Dr. Molly and I have done? Yes, you can. You simply go to the website, innovativemedicalassociates.com, and all of the recent shows are there so you can listen at your leisure, okay? It is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Again, our number here in the studio is 855-839-1210 if you have a question for Dr. Molly. And just when we think we've heard it all, Dr. Molly comes in with something different, and that's a discussion of small vessel disease. And
right.
Obviously we have thousands of small vessels in our body.
You better believe that. You better believe that, John. So listen, everyone who listens to our show is familiar with our cardiac program. And this past couple of weeks, I got an interesting case that came in with a gentleman who was referred to me by a very well-known cardiologist in South Jersey who actually has a mindset about functional and integrative medicine. So he refers this patient over to our clinic. And this gentleman has complete clear arteries. In other words, he's had a catheterization and all his big vessels were open. All right? So you would think, oh, he doesn't have any coronary artery disease, does he?
No, I would think he's perfectly healthy.
No, he actually has small vessel disease. And that really is something, it can be inside the heart. In other words, when you go in for the catheterization, you're looking for the big vessels. You see those. You go in, you can see them on angiogram. You can see all these. But you don't necessarily see how the smaller vessels are. And they may have a form of inflammation, and they may have a form of being sort of squeezed in there. So small vessel disease is something to really, look at from a coronary point of view. So the gentleman's still getting angina, which is why the doc referred him to us. So I thought about this, and interestingly enough, because I am a biochemist and I come out of the laboratory, I happen to know that there was an actual test that actually was in several different parts. In other words, you were doing plasma, blood, and urine in order to really get to a full understanding or a profile of what's going on in his small vessels. And that actually was developed from Cleveland Clinic. And so, of course, I found out where they were doing this locally. I found out that the insurance was covering it, in particular for people who've had a history of coronary artery disease. So I went ahead and did this test, and indeed it confirmed small vessel disease. And what that is, John, is it's inflammation that narrows the endothelial, which is inside the lining. And it's very complex, but really we tried to make it simple, more simple. For example, if you're having angina, what is the number one thing your doc makes you pop?
Aspirin?
No, that and
nitroglycerin. Yeah,
right. Okay. So, yes, they give you the aspirin so that it stops the blood clotting, but they also use the nitroglycerin. And why? Because it widens the vessels and it promotes something called nitric oxide. The body needs nitric oxide from head to toe in order to really continue to function at an optimal level. So, what kind of nutraceuticals might promote that? People with inflammation in the small vessels tend to be nitric oxide depleted. And indeed, we found out this gentleman is. So how do we promote that, John? We know chelation will open up the vessels. And eventually, chelation will go in and open up some of the smaller vessels. But what can I do to help that and promote the nitric oxide? Well, guess what? It's cardiac nutrition. And you hear me talk about that all the time. But what kind of cardiac nutrition? It has to be specific for the demon inflammation that's occurring in this patient. So, for example, L-arginine, you've heard me speak about that.
All the time.
All the time. It's an amino acid. L-citrulline, another amino acid that we use in our cardiac nutrition program. And actually, silicon, quercetin, and of course, vitamin C, D-ribose, and many others. But the point is, you have to use these synergistically to get to these small vessels and to improve what's going on. So this particular condition can be treated, but it's really hard to diagnose.
I was just going to ask you, before the show, we were discussing this, and you said the small vessel issues are difficult to detect.
Right.
Why is that?
Because
they're small vessels?
They're small vessels. So you usually go in for the catheterization because you want to see, well, what's going on, and you don't see anything. You see that they have wide open arteries. Well, then why are they having the angina? So the doc has to do a little more than that. And really what you want to do is you want to test for specific type of challenges with this. Not just, you're looking for things like microalbumin, which is a protein that spills in the urine. You're looking for certain lipoproteins, which means they're proteins that actually make up the lipids that are running around in your body. And if you can split those, which this test does, you then get a better handle on what's going on for someone.
Interesting, because you said there's a test. And I guess my question is, how does a person know that they need or should get the test for small vessel disease?
I hope that their cardiologist starts thinking along the lines, and I hope their family doctor starts thinking along the lines of smaller vessel disease. And the other thing, let's put it this way, there are many road signs that point to that. For example, if your arteries are wide open and you're still getting angina, something else is going on. So you may want to do echoes. You may want to look for congestive heart failure. But there are many things. You probably want to look at these lipoproteins, and that's something that I've been big on from the very beginning. We actually knew their portion of this test is 20 years old. One portion of the test is 20 years old. The new analytes are out that Cleveland Clinic is responsible for isolating. And I actually spoke to a nurse practitioner there because I sent out the test and I wanted to get some clarity around some of the newer analytes. And indeed, these things really point to microvessel disease. However, there are some that cross over. For example, in our clinic, anytime anyone came in, we're always looking for inflammation, right?
Absolutely.
Always, always. So I continue to run C-reactive proteins. Always look for those little devils. And if they're high, I would also look for something specific for cardiac, which is high sensitivity C-reactive protein. That's done routinely at our clinic, but it isn't done routinely everywhere. So there are things. You've got to be somewhat of a medical sleuth in this case.
Which leads me to the question, you said, the cardiologist may suggest this, but sometimes things happen, they slip through the cracks,
Yes.
if you will.
Yes.
So what is an indicator for a patient who may be listening to us now that maybe this is a problem, and what should they do about it?
Well, I think the first thing they should do is talk to their cardiologist and see what he is saying. And if you end up having this Cleveland Clinic test, which I hope he does, and I'm sure he's very familiar with it, and you have some analytes that are out of whack that point towards small vessel disease, I hope you come over and see us because we can help in that area. We can help with just some of the nutraceuticals I spoke about earlier. There are things also, drugs that are out there that someone might go on. The question is, do you want to stay on those? And sometimes you may have to. You may have to.
Talking about, and for years you cut your teeth, and it was part of your beginning stages,
right.
The chelation with
right.
heart and bypasses and so
sure,
on and so
sure.
forth. Is chelation still used, or is
Of
it
course.
a form of it?
No, it is definitely chelation with additional nutraceuticals. I've often spoke here that we don't do a pure chelation. We don't. We're always looking at cardiac nutrition. This is just one more thing in my arsenal that I'm looking to go after by utilizing certain amino acids, certain things, certain minerals like silicon, certain things that we're using in conjunction with the chelation for this particular problem. And by the way, women have this more than men.
Well, actually, that's the number one killer for women, heart disease.
Yes.
And that's been that way. That stat has been that way for years.
Absolutely, since we started.
That's right.
That's
You
right.
and I started doing a show on another station years
That's
ago.
right.
And that was then,
Right.
that was the problem.
And then there's also some renal significance to this. Here's the thing. God makes a perfect body. All right? We know that. There are synergies within certain organs. And look, our kidneys and our cardiac and our vessels all have a relationship to one another. That's why when we look at a patient, we truly do have to look at them holistically. You're just not a function of your cancer or your heart disease or your brain disease or your diabetes for that matter. You are a function of everything that's going on, and our job is to bring the body back to the most important state of balance, homeostasis.
If they are coming to your facility for, the small vessel disease, is this the same thing, 10, 15, 20 treatments, that kind of thing?
I would say more like
More than
30,
that?
40.
Okay.
Because think about this. We're looking at tiny vessels, and we're looking at endothelial, which is the lining of these vessels. Think about how tiny that is. So to reach that, it takes time layer by layer because we don't want to harm your kidneys in the process. So we're very cognizant. Again, the kidneys and the heart have a relationship. So we're very Now, one of the underlying co-conspirators to this is what? Diabetes.
Yeah.
And you know that because diabetes affects cardiac status anyway.
Yes. All right, we're coming up on our halfway point of the show. It's called Health Watch, and we're here every Sunday, 8 till 9. Talk Radio 1210, WPHT. Dr. Molly Fantasia is here. She is the PhD doctor and the executive director and the founder of Innovative Medical Associates located in Marlton, New Jersey. Got a question for Dr. Molly, whether it's about what we're talking about or anything that you have pertaining to a medical challenge? 855-839-1210 is our number here, 855-839-1210. With Dr. Molly Fantasia, I'm your host, John DeMasi. We're coming back with more of today's Health Watch after these words. Welcome back to Health Watch. Operators are standing by right now as we speak at Innovative Medical Associates, and you can contact them at 856-489-0505, 856-489-0505. It's Innovative Medical Associates, Marlton, New Jersey. Feel free to call and make that appointment to sit down with Dr. Molly. The initial consultation is complimentary. And a lot of times you say to yourself, I've been listening to the show, but like if I go there, well, like where do I start? Well, you just ask the question and Dr. Molly would take it from there. All right? Pretty simple. It's a good consultation and it would be well worth your time. 856-489-0505 is the number. Innovative Medical Associates, Marlton, New Jersey. The website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. And, of course, our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPH.D. If you've been listening with any regularity, you've heard over the last couple of weeks that Dr. Molly's new book is out. It is called God's Ingredients, TOO, My 30-Year Journey in IV Nutritional Medicine. I picked up a copy the other day, Dr. Molly, and thanks for your kind words in the
inscription.
Yeah. And I started reading it sitting on the beach. Started reading it.
Oh, it's an easy read.
It's an easy, but this first story of Owen was, I mean, it was I didn't even know about this story.
No, because I don't think he doesn't come in on the days you're there.
Right,
actually.
And I didn't even know who he was. And I'm reading the story, and I'm saying, my God, this guy really went through the ringer.
He did. He
so
did.
Talk about that.
Well, I will. You know, it's so interesting, John. We did a little bit of science in the first half, and that's cool. That's very cool.
Right.
But really, I like hearing the stories myself.
Yeah.
Because my real gauge of improvement is always the quality of life.
Right.
And so Owen is a good intro into that. Owen came to me not so long ago, actually. And he was a mess. It's the only way to say it. He was a mess. He went to work every day. He's an entrepreneur. He owns some fast food restaurants. Very, very lovely guy. But he was completely at the end of his rope. He was on heavy-duty medication, and life just wasn't worth living to him. And I said, whoa, slow down. And I got the history. And I'll be darned, this guy went in for a very simple operation, a laparoscopic, which means tiny incision, right?
Yes.
You know
Yes.
that through the belly, actually, through the front, through the abdomen. Anyway, something went radically wrong. We don't know what. He doesn't know what. And the next thing he knew, he was having tremendous pain down there, tremendous pain in his lower abdomen. So he had to go back into the hospital. They went back in, and they removed somewhere around 2 to 5 feet of his intestine.
Oh, boy.
Oh, my gosh. So obviously he had inflammation there. He gets out of the hospital from that, and he ends up going back in 3 to 4 weeks with a raging infection there. So now they had to go back in, clean the infection out. So imagine he's had 3 surgeries probably within 6 months, not even. And that gets screwed up. So now he's there and he can't eat. He hasn't been able to eat the whole time. So they said to him, the next step would be to put a J tube in, which means a feeding tube. And, of course, I've had experience with that. If you remember my first book, I talked about it.
Yes.
And Owen, although is a little older than Michael was at the time, I said, Owen, could you give me a shot at this? And he said, that's why I'm here, Dr. Molly. I listen to you on Sundays. I said, okay, come on in. Let's talk about it. So, of course, we did a nutritional evaluation, and we realized he couldn't take much orally. So we put him on a whole nutritional regime. And I am happy to say that he put on a few pounds. He's going out. He's enjoying his wife and children now. It's like a miracle. It really is. And I will tell you, I pray every time he comes in because I want this to continue.
Well, it's probably difficult, and we don't want any trade secrets here, but what did you do, or how did you accomplish this?
Well, first of all, we had to really assess his nutritional needs. And, I did that. We actually ran some testing. We realized that he was depleted of all his major vitamins. More importantly, he was completely depleted of his minerals and his essential amino acids. So how the heck could he even get out of bed? I don't know. And if you think about anybody fooling around with your lower intestines and your abdomen down, you realize you really do need those to really absorb your nutrients that you're eating. So he couldn't eat. So the poor guy was like emaciated and everything else. So in doing that, what we did was we put a specific protocol together from him. I used specific types of B vitamins, specific types of C. I also used amino acids that included arginine and things that we spoke about in the earlier, because I wanted to improve his cardiac function and give him some more energy. We also put him on a regimen of a certain amount of liquid vitamins. Now, check this out. God bless our Barbara, who did the research on this and found a tremendously interesting group of vitamins that were liquid in nature. And also, I put him on several compounded things that you actually just put under the tongue. So in doing so, and he also gets D vitamins, which are very important for immune. He gets coenzyme Q10, which is important for cellular energy. And that all has to be delivered by injection. So these kinds of things are what we needed to really put a protocol together for him.
How do people know that that's what they need? I mean,
you have to have an assessment.
Okay.
And we have something called a evaluation that will help us in that regard. But look, I didn't need a crystal ball to know what he needed. When he came in, told me the history, and looking at him, oh my goodness, he was emaciated and depleted, and he looked, I don't know how to say it, except he looked like heck. I mean, that was it.
You look like part of The Walking Dead, maybe.
Right, very pale, nothing. And the poor guy, he would huff and puff just walking in from the waiting area to the clinical area. So right there, I knew he had cardiac issues. See, here's the thing, folks. People don't realize, when you have these surgeries that, screw around with your lower tract, whether it's weight reduction surgery or you have some problems, in that area, inflammation or also things like Crohn's disease, that kind of thing, you're really losing maybe 50 to 100% of your nutrition, period. I handle a lot of people who have Crohn's disease, inflammation in the colon. And again, that has a specific protocol to help in that area. And so I modified that to help our boy. And I feel like we did a great job.
We are talking about a story that is actually the first chapter in Dr. Molly's new book, God's Ingredients, TOO, My 30-Year Journey in IV Nutritional Medicine, available on Amazon.com and anywhere you get books. And why we're talking about it is because I got it the other day and I started reading it, and I was like, oh, this story is fascinating. We have to talk about this on the radio. But another word comes up, and you've talked about it a lot this morning. This comes up in your book. I mean, virtually every other page, and that's the word nutrition.
Right.
And
right.
You talked about it earlier, about how people get it.
Yeah, look, I'm all for going out and finding a good nutritionist. I have several who are good friends of mine. One in particular, Dr. Tamara Carr, who I reference in my book. She and I go way back in certain organizations. And I know good nutrition is necessary. Seeing a good nutritionist is necessary. But there are so many times that people simply can't get enough time to effectuate the change that they're looking to do. And one of the ways to jumpstart that is to come to a clinic like ours. But again, I am not talking about a spa clinic that gives you the menu like a Chinese menu. I'm talking about someone who sits down, reviews the nutritionist notes, who says, okay, this patient has a problem with glutathione, liver. This patient has a problem with insulin resistance. Then we look at what we can do to help them. It's not good enough to say, come in for your headache. Oh, come in for something that's going to give you more energy. That's like kindergarten. What we do is much more involved than that, John.
It's interesting because you talk about nutrition, and I guess people think about, Well, yeah, you mentioned nutritionists. You got to eat more fruits and vegetables.
You can't do it. You can. Look, you can get specific. You can get specifics. Like, for example, I have people who are vegetarians. Right? In fact, one of my assistants, she's a vegetarian. Well, duh. She got COVID, right?
Yeah, right.
Okay.
Yes.
Now, let's look at this. She's a vegetarian. She did everything right. I'm telling you, she did everything right. Now, she has a list of comorbidities, right? She has lupus. She has all kinds of things. So she's absolutely a vegetarian. Guess what? She comes to me. She wasn't my assistant at the time. She comes to me. And she said, I don't know. I just don't feel like myself. She goes and sees my doc, who's her primary. And he goes, Molly, you need to take care of this gal. Well, I did. And as a result, she's now on my team because she will tell you herself. She follows a very strict diet. But guess what? It wasn't enough.
Exactly.
And that's the issue.
So when you're talking about nutrition, you're talking about as part of your hydration therapies,
right?
That the nutritional elements are in the bag.
You better believe it.
Right.
And again, we can assess your absolute nutritional needs by doing an evaluation should you need it. But in some cases, it's so dire, and I've had my share of dire cases. When you come in, people are so depleted, we got to get them in the chair right away.
Right. We are coming up on our final break of the morning. It is called Health Watch. That's the show. Sundays 8 till 9, Talk Radio 1210, WPH.D, which means we got a couple of minutes left of the show and time to take one or two more calls. Don't get shut out. If you have a question or a thought for Dr. Molly, 855-839-1210. That's our number here, 855-839-1210. It's Health Watch, Sundays 8 till 9, Talk Radio 1210, WPH.D, with Dr. Molly Fantasia. I'm your host, John DeMasi. Coming back, more Health Watch after these words. And we're back here on Health Watch. As always, operators are standing by at Innovative Medical, and they will be there well after we leave you at 9 o'clock this morning. So you can call now, or if you want to wait till after the show, feel free. 856-489-0505. 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. And you can also get more information on the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And don't forget, if you miss any of this morning's program, we have our Health Watch replay every Sunday from 4 to 5 here on Talk Radio 1210 WPH.D. Couple minutes left of the show. You want to jump in with a question for Dr. Molly, 855-839-1210, 855-839-1210. We were talking before the break about Owen, a patient that Dr. Molly chronicled his story in her latest book, God's Ingredients, TOO, My 30-Year Journey in IV Nutritional Medicine. We're going to talk about another story, Dr. Molly, and that's the story of Lisa.
Lisa, there's a great story. You know, I like these stories because, again, it goes back to the philosophy of the clinic. What I want to do is see improvement in people's quality of life. We can't cure some underlying conditions. Lisa's got one that definitely, we can't do it. She has a post-Lyme syndrome. Lisa's a young mother. I guess she's now in her 40s. She came to me in her 30s, so she's been with me quite a while. Lisa went all over to all these Lyme specialists, and because her particular test didn't come back totally positive, meaning she had some of the bands that they look for the post-Lyme, but she didn't have enough of them for them to qualify her as having post-Lyme. Well, when she came in to see me, the first thing I said, I looked at the blood work and I said, well, you have several bands here. She said, yes, but you can see, Dr. Molly, we need 3 or more from me. I said, well, you certainly are not feeling like you need 3 or more, right? You're feeling like something's wrong. She said, yeah. I said, here, let me call my doc over. So my doc and I were talking about it. I said, the docs are telling her that she doesn't have post-Lyme. So my doc looked at it and said, well, how do you feel? She said, like heck. And so the doc said, I think Dr. Molly's right. I think you have post-Lyme syndrome based on the fact that you have some of the post-Lyme bacteria floating around in your blood. I mean, it's clearly there. It's just not there in the particular amounts that traditionalists look for.
Okay, we'll pick up that story in a moment. Let's go to the phones. Tom is in Pennsburg, PA.
Hi,
Tom, good morning. You're on with Dr. Molly.
Good morning.
Hi, Tom. How are you?
Very good.
Good.
Thanks for the great show.
Oh, you're welcome.
I'd like to ask, how many nutraceuticals do you think there are that help with chelation therapy?
I think that there are a number, but again, the most direct way to handle chelation therapy is, of course, the amino acid EDTA. The question is, what underlying issues are we looking at? And I think chelation in and of itself may not be enough for most cardiac patients. You know, for example, Tom, are you a cardiac patient right now? Can I ask that question? Are you?
Right. No, I'm not.
Okay. Are you having any symptoms of cardiac or anything?
No, I just want to keep the heart going strong.
God bless you. Okay. See, I see there's a little nuance in there. Then what you're looking at is cardiac nutrition, and along with the chelation in order to keep the arteries open. So cardiac nutrition, there are plenty of oral that we would put you on. But again, the best way to do this, for example, we can deliver the cardiac sugar, which is D-ribose. Yes, you can take D-ribose powder, but, are you getting enough? That's the question. First thing I would do is I would want to check everything out, including doing an echo and seeing how much blood is your heart pumping. Is there a possibility that you do have some blocked arteries? Any of those things. If you go to a cardiologist or your family doctor and you have some of those results, I suggest you come in, see us, and we'll definitely put you on the right track. There are orals. Don't misunderstand me. We all know CoQ10 is something that you can take. You got to get the right form. So there are many. That's an open-ended question, and I love it, Tom. Thank you. Thank you for that.
Answer your question, Tom?
Thank you.
All right, thanks a lot for the call. Okay, thanks a lot for the call. Appreciate it. 855-839-1210. We still have a couple of minutes left of the show. If you want to get in with a question, feel free.
So Lisa, so we started Lisa on our post-Lyme type of protocol. And within one treatment, she went out and she was at least optimistic, more optimistic than she was when she first came to us. Because again, everybody was telling her it's in her head, she's cured of the Lyme, there is no problem. Well, that wasn't true. She really suffered with this. She had 4 kids. She's a dynamic gal. She's a gal who really is in advertising. You know what that's like
yes, exactly
yourself.
Right.
Okay? Marketing and advertising. So she's working morning, noon, and night. Has the kids and really is a wonderful mother. Bottom line, we took her in. We did in the beginning. She was in our chair 3 times a week. We wound her down to twice a week, ultimately once a week, and now approximately maybe once or twice a month. If she's having an episode, she comes in right away. We're able to control the episode with the hydration therapy and, again, move her on along the lines and keep her health up.
How long has it been from the time that you met her until now?
I would say it's well over 3 years.
3 years.
Yes.
And there's progression. You have been seeing a progression.
Absolutely. Not only have we seen a progression, but I would say her overall mood, her overall outlook on life has improved. By the way, she has a young son who's going in the military in a few weeks. So God bless her. She's raising a patriot.
The issue is here, and we have talked about this many times here on the program, is that people come in with these challenges.
Of course.
Why is it that they have to get to the point of desperation?
Well, there it is.
There it is. Until something is done. Who is it? Anybody's fault? Or
no. Here's the thing. Look at what the gentleman did. Tom just called in. He said, "No, I don't really have a problem, but I want to keep my heart from working well." God bless him. That's what we want to do. Keep it. That's the exception. He's the exception,
right? Not the rule.
Right. He's the exception, and he's the exception we want to treat. But it doesn't happen that way. Unfortunately, we are programmed, John, we don't move off of the dime until we're desperate. I think it's true in a lot of cases.
Yeah, and your book points that out, because I started reading. I said, look at this story. It was Owen. then it was Lisa. It was like
there are more.
Right.
It is unbelievable because my book is a snapshot of what goes on every day. And the more I'm in this, the more I realize, look, healthcare today, if you don't take charge of your own health, you're going to be stuck in the monolith, John. The monolith. And you know what? They have navigators, all right. They're going to just keep you going on that wheel.
Exactly, on that merry-go-round.
On that wheel.
In their system.
You better believe it. And sometimes, folks, you got to step out of your comfort zone.
And that is difficult to do because,
of course it is.
Unless they find a show like this, and you've had patients who have said, I can't believe this is on the radio. I heard this. It's like, unless they get this or they know somebody, how do they find this stuff
Here's
out?
the thing. Somebody said to me just recently, a term I use all the time, we're the best kept secret in Marlton and the Philly area, right? And we are, because we're understated. Look, bottom line is, the way I look at everything is, it's not about me. It's about our patients. You want to know about this medicine, please come in and talk to our patients. Talk to our cancer patients. See how they're doing. Listen, what's a win? A win is, and I'm not going to cure cancer, but if I can help you through the traditional treatment and you're feeling good at the end of it, isn't that a win?
Absolutely.
It's a win to me.
And keeping your immune system going,
right.
Because a lot of times that's compromised.
COVID. Everybody's focused on COVID. Guess what? Look at my book. I'm not focused on COVID. What I'm focused on is your immune system.
That's right. And we have talked about this forever.
Right.
That I have felt like I was so protected in the height of the COVID.
Well,
because of the vitamin C treatments and the nutraceuticals.
Taking care of yourself.
Right.
And here's the thing. We're worried about COVID. I'm worried about diabetes. I'm worried about cancer. I'm worried about Lyme disease. I'm worried about MS, lupus, you name it. Those are the things I'm worried about. And how do we solve it? Immune enhancing kinds of therapies.
All those things you mentioned have been around a lot longer than COVID.
You bet. And that's why I say all we're doing now is focusing on this big giant, like it's the only time in the history of our world that something like this has happened. Honey, I remember when we had swine flu. I remember SARS. This is just me, right?
Yes.
Okay. My parents remembered things like the flu that they had in the old days.
Polio, remember
right?
polio?
When you had to take the polio shots.
Right.
Come on, guys. Let's be real. We have a lot of problems today.
And with that, we are putting the wraps on another edition of Health Watch. Don't forget, operators are standing by, and they'll be there well after we leave you at 9 o'clock this morning at 856-489-0505, 856-489-0505, Innovative Medical Associates, Marlton, New Jersey. And don't forget, check out the web. A lot of good information there and some recent radio shows that we've done at innovativemedicalassociates.com, innovativemedicalassociates.com. Oh, and don't forget, we have our Health Watch replay this afternoon, today's show this afternoon from 4 to 5 here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, fabulous Fran, we have Joanne, and our nurses Jess and Crystal. I'm your host, John DeMasi. Thanks for listening. Always a pleasure. Have yourself a great week and a healthy one. We'll do it all over again next Sunday. Health Watch, 8 till 9, Talk Radio 1210, WPHT. You take care.
This program is a paid commercial announcement and in no way represents the views of WPHT or its management.